Hey, OncoPT, and welcome back to this episode of the OncoPT podcast. Now, before we get into today's conversation, one of my favorite things in the PT world are conferences. And yes, I love going to conferences because we get to go to these amazing educational sessions. But what I really love is getting to meet different physical therapists from across the country and sometimes even across the world. And I was so privileged. I don't know if you remember this, Mercedes, but we went to lunch in San Antonio
Yes.
with Katie O'Bright. And it was such a cool group of other physical therapists. And our guest today was one of them. And just the conversations that were happening were so cool to be a part of. And so
It was so
anyways,
memorable.
I'm so excited that I have Dr. Mercedes Aguirre Valenzuela on the podcast today to talk about a really exciting topic. So Mercedes, welcome to the OncoPT podcast.
Hey guys, thank you for having me.
Oh my gosh, we had that lunch was genuinely so cool because there were so many different people all over the country, all different practice areas.
Yeah.
And it was just instant. Like when I was introduced to Mercedes, I was like, this PT is so cool. Like I want to be just like her. And I'm so thrilled to have you on. Can you tell my listeners a little bit about yourself and how you got into physical therapy and a little bit about how you got into the work that you do now and why I have you here on the podcast?
Yes, well, thank you for having me. I mean, I wish I had your drive, girl. Look at you. So I'm Mercedes. So I became involved in a lot of advocacy work. Um, Basically, I immigrated to United States from Argentina at a young age. It was due to because in my country we were going through a Great Depression. Basically, I was born into political issues, and because of political issues, I came to this country. So it's kind of been a part of my life, my entire life. Um, and then during the 2016 election, I decided that I wanted to run for public office, representing women. But I wasn't even in PT school yet, so I was like, let me just focus on that. And then once I'm a physical therapist, I'll do it. And I did it. And it was an amazing experience running in the general election this year. I ran for town council.
Amazing.
And I just wanted to share it, with you and all of you out there because I know that PTs and PTAs can make the best politicians.
And there's not a lot of us. I'm really not aware of a whole lot of PTs. I'm sure there are, right? I'm sure there are out there, but I'm just not well connected to the PTs and PTAs who are in that kind of leadership, which is really exciting to think about.
Right. And if they are, I mean, they may not be, around our age. So, I ran, to help on my community and also to show that I'm still a new graduate. Even as a new graduate, I still have the skills and expertise to lead my community.
Mm-hmm. And I think that's so important, especially now we're seeing a lot of healthcare issues. I mean, it's not a new thing, right? But we're seeing a lot, I feel like, more healthcare issues that are in the news, that are in politics right now, that are being, legislated on and around, which I think is just that much more leverage and importance as to why we're having this conversation today. Because as I shared off air with Mercedes before we started interviewing, this hasn't been something that we've really talked about on the podcast formally. I've talked around it, but it wasn't until this last year in 2023 with the recent passage of the Lymphedema Treatment Act and then the proposed sunsetting of the S codes for DIEP flap and other autologous tissue flap reconstruction that I really started to be like, oh, this is actually really important that me as the physical therapist needs to be advocating for my patients, not just in the clinic with my patients, not just with other healthcare professionals, but in the political arena. Things are happening right now that are affecting our patients that we as physical therapists need to have our hats in the ring. So can we talk a little bit more about how you got involved in advocacy and why you felt as a physical therapist it was so important for you to continue this interest and this passion and this work of yours in advocacy.
Yeah, so thank you for sharing that because I didn't even know it myself. So there's so many things to advocate for. That's what we all gotta do it, right? So I got involved in advocacy because I'm the type of person that I don't like to see kind of change go by. I like to be a
Mm-hmm.
part of the change. If there's an issue, I want to act towards it and solve the issue. So with advocacy, you can use your voice, even if you're a person. You can email legislature, you can call them, you can have a meeting with them, and it can be just you. And I feel like that is so empowering because sometimes, as healthcare professionals, PTs in particular,
Mm-hmm.
we feel as though we don't have such a great voice, but we actually do. I had meetings with staff of a U.S. representative, and weeks later, she was a co-sponsor of the pelvic health bill. So you
Oh
can
my
do things like
God.
that. Yes, you can.
Holy cow. Oh my
Yeah.
gosh. Talk about in real time seeing that happen. That is
Honestly,
that
one of
is
the
so
top
exciting.
greatest moments of my life.
Oh my God. Okay, can we talk about how did you do that? Like, what was that process like? Because not only, because like when I was in PT school, we did PT Day on the Hill here in Texas. Like our school was located just down the road, basically from the Capitol, and so we like went to the Capitol and we were organized into these different rooms, but it didn't really feel like it went anywhere. It was just like, oh, this was a nice gesture or whatever. But Mercedes, you were like boots on the ground making it happen. Oh my gosh.
So a lot has to do with timing. So
Okay.
I knew, and this was U.S. Representative Mike Cheryl. I knew
Mm-hmm.
at the time she was focusing a lot on maternal health because of previous meetings I had with her staff.
Okay.
And I was going to have a meeting with her staff during the August recess. And I wanted to just kind of take advantage of what they are currently interested in.
Mm-hmm.
So I invited a pelvic health clinic owner who actually owns a clinic in the Congresswoman's hometown. And so I think that really was a significant change because it wasn't just me, I'm a pediatric PT, right? I feel like a clinic owner in
Mm-hmm.
her hometown speaking of patient experiences and their limitations, and there needs to be more understanding of pelvic health overall. And that was just, I think that really resonated with the staff.
Oh my God. Did you pick like a random day to go and do this? Like, talk me through some of those logistics of like, how did you make that happen? Because I think that's one of the biggest barriers that a lot of physical therapists
Hmm.
see and perceive is how can I, as the one PT, make this happen? But like, again, Mercedes literally did, y'all. Like, oh my God.
I mean, it's really simple. You just contact you go on the website of, whatever congressperson, you contact them, you email them, and you ask, for a meeting. I did this during the August recess, which is kind of like the prime time to have those sorts of meetings,
Mm-hmm.
because Congress is in recess. So that's why they are in recess to have meetings with their constituents. So
Mm-hmm.
that was a good time. And then I've been having, this wasn't the first time I talk about this public health bill with the staff.
Okay.
It was probably like the fourth time I had a meeting about this. So you
Wow.
have to
Okay.
build that relationship.
How did you start building that relationship?
Um, so meeting them a couple of times a year, at least twice a year. So we
Okay.
have the APTA, the Advocacy Day, where we go to Washington, D.C. all together, and then we have the August recess. So those two times, and also
Mm-hmm.
having like regular connections through email, like if there's something that comes up, like um, for example, we're having like cuts possibly in Medicare,
Mm-hmm.
just telling them about that, just like a constant, communication every now and
Mm-hmm. So, as far as, you know, right now we're talking about these kind of big twice a year days. And those are
then.
definitely,
Yeah.
I think, a little more of like, it's I don't know a better word. It's kind of flashy to, go into the Capitol building because then you're
Mm-hmm.
usually dressed up. Like I'm thinking of, like in a blazer, walking up
Yeah.
the steps and meeting with these representatives. And like there's a lot of excitement behind that, but there's a
Yeah.
ton of work that happens before we can get to that point, right? Because you
Mm-hmm.
talked about working on establishing those relationships. I mean, like 4 meetings over the course of, I'm sure, several years. And then that constant communication, not even constant communication, but regular communication
Yes.
with
Mm-hmm.
the representative and their staff. So I guess my question here is like, what kind of things, if I'm listening to this podcast right now, I'm thinking, wow, this is really cool. How can I get started on the path to where I can eventually meet with my representative during like the August recess or whatever to discuss these issues that are really important to me as a physical therapist?
So you can go on the APTA website, apta.org/advocacy, and you can become a key contact. There's actually an email for that. It is advocacy@apta.org. And just say they're interested in becoming a key contact. And then
Mm-hmm.
you start off, it's not August yet, right? So you just start off by like sending regular emails. And the APTA gives you like a template. It's not like you have to like type it out yourself. It's like really,
Mm-hmm.
really simple.
Mm-hmm.
And then if you start now, you'll be ready by August.
I'm really glad you brought up the template to Mercedes because I remember thinking back to the years leading up to when the Lymphedema Treatment Act was eventually passed. I'm on their email list and they would send out different
Hmm.
campaigns. And it was so nice because a lot of times what you could do is you could click a button and it would take you to a form or like kind of like a Google Doc is not the right phrase, but they had an email already
Yes.
typed out and you could just
Hmm.
put your name into those different fillers. And it was set up to where it would automatically, once you push send, it would send it to the representatives in my area. So, like my area in Texas. And I think that makes it a lot less intimidating to be
Yes.
involved in these things without having to like draft an email by myself to my senator or my representative.
Yes. And they look at those numbers. Okay.
Mm-hmm.
So if you have a lot of constituents concerned about something, those are the people that are voting for them. Okay. So if you have 5 people that care about something and you have 100,000 people that care about something, I mean, honestly, they're going to care about, what most people care about. Okay. Because it's all about winning an election and continuing on, what they're working on.
Mm-hmm.
Um, so there is strength in numbers.
I think as you're saying that, Mercedes, I think sometimes it's really easy to get disheartened or frustrated.
Hmm.
But that is something that I've heard a lot of as far as like they do get those emails, they do get those voicemails, and however else they're sending that in. But it really is like it's a strength in numbers things. And
Yes.
like they're looking at that. If it's not them directly, it's their staff that are looking to see
Yes.
like how many people are reaching out about this information. And again, like I keep coming back to the Lymphedema Treatment Act because I think it was such a community effort across the country for so long to finally get it into action, but it really did take the numbers of people
Yep.
over time just like kind of wearing it down until it was like
Hmm.
there's no reason not to pass this anymore because the support is so overwhelming. And I think it's also, I think, a really powerful lesson learned because of how long it took to get passed. But we did it, y'all. We finally did it. It is into law. And I'm really excited to see what happens with that. So, with all of this in mind, Mercedes, when it comes to a day in the life of Mercedes, the physical therapist, and also this advocacy force to be reckoned with, like, what does a typical day look like? Because I feel like it would be very easy to be like, it's so overwhelming to try and keep up with everything that's going on and be contacting these representatives. Also, yeah, I'm supposed to treat patients amongst all of this. Like, how do you make it work?
So I work in early intervention. I do contract work. So
Nice.
basically, if a patient cancels, that's when I'm like going emailing everybody. and getting work done. So basically,
Yeah.
that's how I do because I don't like taking work home. I really don't.
Love it.
Um,
Love it.
so that's how I do it. Um, I have a lot of meetings during the week. I'm in the Public Policy and Advocacy Committee of the APTA. I
Mm-hmm.
do meet with my local party monthly. There are other community groups that I'm involved in. But what's
Mm-hmm.
really important is, whatever you do, make sure that you like what you're doing and it's not just like another kind of responsibility, like another task that you have to do. Just
Yeah.
keep it exciting.
So, what special areas of advocacy have you been involved in and are you continuing to be involved in? Because I think, as much as like we're like, yeah, patients and physical therapy, there's a lot that falls under that. And I also know
Yes.
like we're humans outside of that and we have other interests. So, like, what are some of these things that you're advocating on and for in your community?
So, like I said earlier, the timing is everything. So, right now, most important thing is making sure we don't get those cuts in Medicare.
Yeah.
They're going to start in January.
Okay.
So we need to advocate like yesterday.
Mm-hmm.
And we need to contact our legislators for that.
Mm-hmm.
And then, in terms of the public health bill, like the timing was right. So I was really advocating, really hard for it at that time. Um,
Mm-hmm.
it's just like there's just different things that happen at different times. You just focus your energy more on.
Mm-hmm. How can I know what those things are to pay attention to when? Because I do feel like there's a lot to keep up with.
Yes, there is. And so APT has an advocacy newsletter. So when you go to apta.org/advocacy, you can join their newsletter. And if you become a key contact, you'll be automatically in that newsletter.
Mm-hmm. Mm-hmm. So I think there is a tendency sometimes, and I think I see it because I'm on social media all the time, and people on social media are vocal about things. And there is very much an attitude prevalent within physical therapy about like, why should I care? Because I'm only one PT. I really can't make that much big of a difference. It's frustrating to feel like I'm not being heard. Why should we be involved in advocacy and these bigger advocacy efforts beyond just the walls within our clinic?
Because I mean, if it's not you, then who? You we are the physical therapist assistants, students, that want to go in that field. We're the
Mm-hmm.
experts. And so our voice does matter and our voice needs to be heard because we have the boots on the ground.
Yeah.
And whatever setting you're on, like I'm a pediatric physical therapist, I work in early intervention. A lot of the things related to me will be more regarding like the IDA, Individuals with Disabilities Education Act.
Mm-hmm.
Medicare doesn't really affect me. Private insurance doesn't affect me, but I still advocate for that
Mm-hmm.
because it's about the whole, not just, me.
Mm-hmm. What is something, or what are some things that have surprised you since you have been professionally advocating, like as a physical therapist, for a few years now? Because how long have you been practicing, Mercedes?
Um, 3 years, about 3 years.
Okay. So
Yeah.
you've been practicing for 3 years. You're out in the
hmm
field, very aware of these patient issues and other issues in your community. What are some things that have surprised you as you have been pursuing advocacy on these bigger scale efforts?
So things take a long time. I remember advocating for years for the Workforce Diversity Act, which gives grants to diverse students in allied
Mm-hmm.
health professions.
Mm-hmm.
And it's like it's something like, okay, obviously you gotta pass this. I mean, it's so important. But like no, it takes time. Like each year you gotta like
Mm-hmm.
reintroduce it, get more co-sponsors
Oh
for
my
the
God.
bill. Kind of like you're starting over. But you just gotta keep staying positive, because that actually eventually did pass and it was like really awesome. And it's just so like when you're part of that,
Mm-hmm.
you know, even if it's like a really small role, even if you just send like an email about it, it makes you feel like really proud, like, you help achieve something.
Mm-hmm. What are some recommendations or maybe encouragement you would offer for PTs who are newer to advocating beyond the walls of their clinic and who are interested in participating more in this?
That is so simple. Go on Google, type in the APTA Patient Action Center, and you can advocate to stop the Medicare cuts, and it takes literally 2 minutes, like Elise said. Oh, yeah.
Which, again, for a busy clinician, is really, really, it really is that easy to just type in your name and submit that letter. And again, going back to
Yes.
something that Mercedes talked about already, which is they look at the number of people who are writing in and leaving that information and your support for different causes. So if that is the only thing that you can do, that still counts, y'all.
Yes,
I
please
know
do.
when I was, gosh, I hadn't thought about this in a few years, but a couple years ago, I was at my old job, and it was like one of the times that the Lymphedema Treatment Act was trying to be passed. And it was, going through the rounds, like you were talking about, Mercedes, of like it
Mm-hmm.
had to be reintroduced and then they had to get co sponsors. So they were in that initial like reintroduction, co sponsor, getting people on. And I actually had patients who I would talk to them about the Lymphedema Treatment Act. I was like, hey, and I think that's one of the things that I've really liked about that is that my patients are dealing with lymphedema. Like it is very
Mm-hmm.
present, very in their face. Like this is my reality right now. And so talking to them about, yeah, you know what? It really sucks that your insurance isn't covering your compression garments. But let me tell you about this Lymphedema Treatment Act that we're trying to get passed that will change that. And that was a really, really big connector for my
Mm-hmm.
patients. And I never forced them, of course. Like it was totally optional. But I told them, I was like, if you would like, I can send you an email with the link to where you can write in, like you can send an email to help us with this or whatever. And I think that was also something because, again, the patients were like, yeah, it really freaking sucks that they won't cover my compression garments. It's like, then you can
Yes.
help us with this. And I do feel like it was, again, it still took a few years before it was passed. Don't get me wrong.
Yes.
But that kind of like getting people involved and feeling
It's
like,
empowering.
yeah, it is empowering. And it feels so good to be able to be like, I helped with that in one small
Yes.
way. I helped
Yes.
with that.
Mm-hmm.
What are some things now moving into 2024 that you are like, you know what, this is coming down the pipeline? Or, like, I know I really want to get involved in this. Like, what are some things that you're looking forward to helping, advocate for in your community in the new year?
Um, so now since, I'm done with my election, done with my campaign, I
Mm-hmm.
want to continue on advocating at a community level, things not just related to healthcare. I kind of
Mm-hmm.
want to diversify a little bit.
Mm-hmm.
Um, and right now, I'm advocating for gun violence prevention. I am trying to look into advocating for affordable and safe housing in
Yeah.
my community.
That is so exciting. How, because again, like I mentioned previously, we're physical
Mhm.
therapists, but we're also humans outside of this. How can I get plugged in or how can I find these different causes in my community that I know I'm interested in, but I want to be like advocating for them now? What kind of recommendations would you give on that?
Um, I mean, you can Google.
I like it. I
So I
like it.
mean, so I so I so the reason why I want to advocate for affordable and safe housing is because as an early intervention physical therapist, I've been into houses where I feel that my patients are not safe and the conditions are, you know,
Yes.
just terrible housing conditions. So I was like, how do I
Yes.
advocate for this? Go on Google, advocacy, safe housing, and then some. it just came up. Not like, sorry, not like a detailed answer, but
Yes.
yeah, you can try that. Or you can DM me
I
and
think
then we'll figure it out
that's
together.
yes, that's so genius though. Like that I'm so glad you brought up the affordable housing. So I live here in Fort Worth, and my husband and I were invited to like a young professionals meeting like last spring. And we had no idea how challenging affordable housing is in Fort Worth. And like this meeting was so helpful because they laid out just so much information. We had no clue. Like, and we had no idea until we went to this meeting about just how widespread of a problem it is. And I think
Hmm.
that's one thing, like, we just happened to like our friend just invited us and we're like, yeah, sure, this sounds interesting, let's go. And we came away with so much information and feeling more empowered to be like, we got to do something about this. And so I think that's one experience that I've had recently that was
Yep.
like, I'm kind of interested in this, it sounds interesting. And then coming away from that, I felt really, I don't know if galvanized is the word, but I felt like I had a fire lit under my butt to be like, oh,
Yes.
we need to do something about this.
Right. Hmm.
And so I think that's kind of influencing me. And there's lots of other ways to find out. There's a lot of really good like social media accounts that I've gotten plugged into over the last year that do a really good job of like educating on different, like local elections that are taking place in my area and across the state. So even if maybe a listener doesn't know exactly, I'm interested in these things, but I don't really know how it kind of all fits together. Social media has been a great place for me to get connected to different ways that I can then advocate further for my
Yes.
patients in my community. So, like Mercedes said, Google, great place to start. Social
Yeah.
media can be a great place to start too.
Yep.
For the listener, Mercedes, who is kind of like me, who has now got this fire lit under their butt. They know I got to do this. I'm
Yay.
excited about this. I want to be a part of bigger change. What is one step you would recommend that they take today to get started with this?
Yes. Okay. Go to APTA, Patient Action Center. You don't have to be an APTA member. The link can be given to anyone. And send a letter to your congresspeople to stop the Medicare cuts, please, because you only have until January. Well, it's going to be implemented in January, so we don't have much time.
Ooh, that's good to know. That is good to know.
Yeah.
And I'm sure they're going to have updates, like as the new year comes around of like, hey, here's our next step that we're going to be working on. Yes.
Yes.
Yes. Love that. Mercedes, where can people follow you on social media?
The PT Advocate on Instagram.
We will, of course, be linking Mercedes' contact information in our show notes. This conversation, Mercedes, I know I mentioned this before we started recording. I genuinely did not understand how big of a role that PT had to play in advocating.
Hmm.
As a clinician, it feels sometimes disheartening to be like, gosh, I just don't know what I can do. But as Mercedes talked about in this episode, there's a lot that we can do. And it doesn't have to be that you fly to Washington, D.C. and, march up the steps to the Capitol. If you want to do that, that's super cool too, friend. But there's a lot
Hmm.
of really small steps that we can take that don't take that much of your time, but are so important because they add up when we work together. And I would really, really encourage you, let's advocate together for our patients,
Yes.
for our community, for our profession, because that is the only way that we're going to make change happen. That is for the best of all. And so, Mercedes, I'm so, so grateful that you came on the podcast today. I'm so excited that we finally
Thanks.
got to sit down and have this
I
conversation.
know.
It was so fun, and I'm just so grateful to you.